I believe that you should only do liposuction once. It's rare that I ever have a person coming back for a touch-up or to take out more from a certain area. This is what I specialize in. I'm known throughout the world for doing liposuction. I have lectured throughout Thailand, Korea, all over the United States. I've actually performed surgery, telecast in Korea in front of the Korean Society for Plastic Surgery with almost 400 plastic surgeons present. It's an office-based procedure. It's done here right in my office. I have an anesthesiologist present, usually either a surgical tech or a nurse. The surgery tends to take anywhere from 30 minutes all the way up to 3 or 4 hours, depending on the areas that are going to be liposuctioned as well as the size of the patient. Most patients stay here only 30 minutes to an hour after the procedure. They recover right away and they're able to go right home. Generally going back to work, I tell people most commonly in like 4 to 7 days. Now, the different types that you hear of are the ultrasonic or the vaser or laser, all different type of procedures. I used to do ultrasonic liposuction years ago, and I did it for probably about 6 to 8 years, and then I finally stopped after I found that the results were no different using the ultrasound versus the standard tumescent liposuction. So I've abandoned ultrasound completely. I've been for over 13 years using the tumescent technique. Almost everybody uses tumescent liposuction. What that means is basically before you take the fat out, you're putting a fluid in, and that fluid is called the tumescent fluid. The tumescent fluid is a mixture of salt water mixed with some novacaine or lidocaine to numb out the area so the anesthesiologist doesn't have to give you as much general anesthesia or sedation, as well as adrenaline or epinephrine, something naturally found in the body that causes the blood vessels to shrink so there's very little bleeding. The thing that we use to take out the fat is called a cannula. A cannula is something like these two things right over here. And obviously there's a big difference between them. This cannula is good for removing a lot of fat rapidly, but the problem that you have with these type of cannulas is that you could get denting, or you could get cellulite, or another thing which is called a cannula line, which is this shape left throughout the fat when the healing is done. I tend to use the smaller cannulas, something like this, which is a size 3. And I start with either a size 3 or maybe even a size 4, depending on the patient, and then I go down in sizes. I find that these are much less apt to leave any dents or any cannula lines or anything like that. So I think it's a much safer technique.